Good day, everyone. Welcome to another video lecture on obstetric nursing. I'm Nicole Gonzagales, and today we will be focusing on the topic cancer during pregnancy. Yes, you heard it right. Cancer can occur during pregnancy. It's rare, but it poses significant challenges to both maternal and fetal health. The managing cancer in a pregnant woman is uniquely complex as it involves treating the disease while also protecting the unborn baby. But before diving deeper, let's go back to the basics. What is cancer? Now, cancer is a condition that arises from cells growing uncontrollably, forming abnormal masses or tumors. This is a disease that starts when abnormal cells grow without control and they don't function like normal cells. They often form tumors, lumps of tissue or growths, which can sometimes be felt or seen. They can invade nearby organs, damaging them as they grow. And worse, they can spread or metastasize to distant parts of the body like the lungs, liver, or bones. There are over 100 types of cancer classified based on where they start in the body. And some types are more common and frequently seen in clinical settings. The most common include the breast cancer, usually found as a lump or changes in the breast. Next is the lung cancer. Symptoms include persistent cough or breathlessness. And the colorectal cancer. Now, what causes cancer? There are risk factors that increase a person's likelihood of developing it. And this include the age, family history, lifestyle choices like diet or smoking, environmental exposures, and some infections like HPV. Now that we know a background on cancer, have you ever wondered, what if cancer and pregnancy coincide? In this lecture, we will be talking about the following: the common types, the breast cancer, cervical cancer, lymphoma, and the thyroid cancer, the causes and risk factors, the ethical and emotional aspect in the context of the nursing roles, and the nursing implications. Now, cancer during pregnancy is rare, but it is possible. It occurs in about 1 in 1,000 pregnancies. And because of its rarity, it often catches both patients and healthcare providers off guard. But even though it's rare, it has a serious complication. We're dealing with two lives, and this is the main challenge that it presents: safeguarding two lives at once, the mother and the child. Now, here are the most common cancers diagnosed during pregnancy. We have the breast cancer, the cervical, lymphomas, and the thyroid cancer. Let's first start with the breast cancer. It's the common malignancy in a pregnant woman. It's the uncontrolled growth of malignant cells in the breast tissue. And symptoms include lump, changes in the breast size, nipple discharge, as well as breast swelling. For the diagnosis, breast ultrasound is usually preferred, and the biopsy confirms for the diagnosis. Surgeries may be done in all trimesters. Chemotherapy is recommended in the second and third trimester, while radiation and hormonal therapy are delayed until after delivery. Next is the cervical cancer. This is the malignant growth in the cervix. It's often found during routine prenatal pap smears and the persistent infection with high-risk human papillomavirus types. Symptoms may include painless vaginal bleeding or watery or foul smell discharge, pelvic pain or discomfort, and in later stages, there might be bladder or bowel issues. The management for the cervical cancer depends on how advanced the cancer is and how far along the pregnancy is. For the delivery, vaginal delivery is contraindicated depending on tumor location and size. C-section is usually recommended. Next is the lymphoma. This involves cancer of the lymphatic system. This includes the Hodgkin and the non-Hodgkin lymphoma. It may present with swollen, painless lymph nodes, fatigue, weakness, night sweats, weight loss, and itching. MRI and ultrasound are preferred while CT scans are avoided. And for the treatment, chemotherapy is often used during the second and third trimester. Radiation therapy is also delayed until after delivery. Lastly, we have the thyroid cancer. This is the abnormal growth of cells in the thyroid glymphatic system. This is commonly known as the papillary thyroid carcinoma in pregnant women. For the unique signs and symptoms, it may appear as a lump in the neck, accompanied by hoarseness and swallowing difficulties. Sometimes there might be breathing difficulties and the rapid growth of thyroid nodule. Ultrasound is the first line imaging for diagnosis, while treatments are often delayed until postpartum and until after delivery and breastfeeding. The risk factors and causes remain the same for cancer during pregnancy. For age, we have the advanced maternal age of 30 to 40, genetics on having family history, the BRCA mutation, or the cells or genes that are responsible for the suppression of cancer development, lifestyle choices including smoking, alcohol, and having a poor diet, and also hormones, specifically high estrogen exposure. But what makes pregnancy unique is the emotional toll, the hormonal changes, and the added stress of making decisions for two people. That's where nurses play a crucial role in. For autonomy and informed consent, it is a must for the nurse to respect the mother's right to choose treatment, continuation, or termination of the pregnancy. An emotional impact, the nurse must be aware that cancer in pregnancy can bring anxiety, grief, fear, and uncertainty, and that he or she must be able to address these concerns. And that is why the provision of support systems is crucial and important in ensuring the well being of the client. Now, this brings us to the major nursing implications that we must consider when we give care to patients who experience cancer during their pregnancy. First is the holistic care role. It is emphasized that nurses must address all aspects of the client in order to provide adequate and accurate care. Next is ensuring that we are able to fulfill health teaching and advocating for the rights of their clients. Lastly is the team coordination. We must act as liaisons among specialists to ensure that the patient receives comprehensive care. Pregnancy may bring new life, but for some, it also brings unexpected battles. Early detection, informed decisions, and compassionate care can save two lives at once.